Periodontics, the branch of dentistry concerned with the structures surrounding and supporting the teeth. Periodontal disease, also known as gingivitis, involves infections along with inflammation that destroys the tissue that support your teeth, including the gums, the periodontal ligaments, and the tooth sockets. The study of periodontics is beneficial and a necessity because periodontal disease affects more than the eyes can see. Having periodontal disease is very dangerous because, through recent studies, having this disease makes you much more likely to have stroke, diabetes, heart disease, preterm births, arthritis, and many more. Some factors which can cause this are poor oral hygiene, smoking, stress or tension, diet, or age. Some symptoms include red or swollen gums, bleeding while brushing your teeth, aching, itching, sore, or tender gums, bad breath, and spaces between the teeth. Janine Colt works for Dr. Jeffrey Rogers at Periodontics and Implant Surgery located in Auburn, Washington. Growing up, Janine's main influence and inspiration to take part in periodontics health was her dentist. Janine attended Washington State University and then was fortunate enough to travel to Switzerland, where she practiced with 2 Swiss dentists and another Irish dentist. Traveling there was a fantastic opportunity for her to learn French, travel, and immerse into a different culture. Her experience in Switzerland also helped her make sure that that was the type of work she wanted as her career, and also helped her become familiar with terminology and treatment procedures. After she returned home, she attended Clark College Dental Hygiene Program in Vancouver, Washington. To become a periodontal hygienist, many years of studying and practice is required. Some recommended classes are microbiology, human anatomy, histology, embryology, orofacial anatomy, dental radiology, contemporary dental hygiene care, general and dental nutrition, general and oral pathology, pharmacology for the dental hygienist, and periodontology. These classes are different for certain colleges, but most can include lectures, book study, traveling for different viewing, tests, or practicing. The minimal education requirements typically consist of a 2-year certificate program or associate's degree program in dental hygiene. This must be from an institution accredited by the Commission on Dental Accreditation. This level of education will qualify dental hygienists to pursue state licensure, which almost every single state requires. The top 10 schools worldwide for the study of periodontics and dentistry are the University of Dundee Dental School, University of Leeds, Queen University Belfast, University of Sheffield, Cardiff University, Eastern Washington University, the University of Tennessee Health Science Center, Idaho State University, and West Virginia University. Being a periodontal hygienist, Janine is required to have a few very important skills that help her on her daily life as a hygienist. Social skills help Janine communicate with her patients to understand more about how they are feeling, what they may have been doing to cause this disease, and a lot more. Some technical and science-based skills include knowing how to operate some machines used to perform daily checkups, procedures, and surgeries, using good judgment, asking herself scientific questions that help her see what type of disease they may have, and what instruments would be most beneficial for each patient. Science plays a big role in being a periodontal hygienist. Janine uses the scientific method each and every day to help her and her patients. Making observations. She observes how bacteria can be harmfully affecting the patient's teeth, and if there are any questionable lumps or other marks that can help her tell what type of periodontal disease the patient may have. Hypothesis. She hypothesizes based on her observations what type of periodontal disease it can be, and what procedure she is to use on the patient to help get rid of this disease. Designing experiments. She lays out her observations and comes to conclusions on what they are to follow with, whether it's surgery or a different procedure. Collects data. She writes down the progressions the patients have from checkup to checkup and continues to collect her data. Analyzes data. She looks at her collected data and analyzes what the progressions mean and what they show. Report. After collecting and analyzing her data, she can come to the conclusion on what type of disease they may have and how they should follow with it, whatever procedure is necessary. A day on the job as a periodontal hygienist can be very long. She starts at 8 a.m. and ends around 5 p.m. During these hours, her work can consist of working on around 8 to 10 patients, 4 to 6 teeth cleanings, taking many x-rays, patient education, sterilizing their tools, and sometimes helping perform different procedures. Janine quoted, "A successful hygienist is organized to use time wisely, uses interpersonal skills, is decisive, skilled with dental hygiene instruments, and has patience and compassion."